Gary. I'm a hair transplant surgeon, and I wanted to talk about Justin Bieber. He is an amazing musician, and I play his music in the operating room all the time. We're going to be talking about Justin's hair loss. We're going to be talking about androgenic alopecia, traction alopecia, and what men ought to do when they're in a situation like Justin and starting to see the early signs of hair loss. In 2012, at the age of 18, Justin has a very youthful hair appearance. He's also combing it down, so he has even more coverage, and it just looks like a great head of hair. 2013, at age 19, also you can see just a very, very youthful Norwood 1 type of appearance with very high density at the hairline. The temples are well outlined. He has all this like baby hair, fine hair up front. I mean, it just is very youthful, very framing to his face. 2014, age 20, also similar appearance, not much has changed at this point. 2015, age 21. You can sort of make out there's very early frontotemporal reduction of density, but it's still looking extremely youthful. Age 22 in 2016, also a similar appearance. At age 23 in 2017, I'm seeing the first signs of frontotemporal hair loss, and he's inching towards a Norwood 2, and this appears to me to be an androgenic alopecia type of situation, which is the most common type of hair loss in men, and this is a very common pattern that we see. It typically will start with the frontotemporal areas starting to recede back, starting to thin out, and the entire hairline slowly starting to come up, so you have more forehead showing. Those are the early signs of androgenic alopecia, and that's what we're starting to see with Justin Bieber in 2017. In 2018, at the age of 24, Justin Bieber now has a more defined Norwood 2 type of hair loss pattern. He has more frontotemporal recession. You can see an M-shaped pattern to his hairline. Age 25 in 2019, he has a very similar pattern. Age 26 in 2020, again, something very similar. But in May of 2021, he changed his hairstyle. He changed it to dreadlocks. And so I wanted to take this moment to talk about traction alopecia. This is a type of hair loss that occurs when you put the hair on stretch. You are then causing inflammation to occur at the root, at the follicle of that hair shaft. And when you have this type of inflammation, it can eventually lead to hair loss. So he has to be very careful because he already has those signs of androgenic alopecia that we talked about before. And on top of that, he's adding the insult of traction alopecia, and potentially that can lead to a more accelerated type of hair loss with his condition or his situation. So then in May of 2021, he decides to get rid of the dreadlocks. And this is really interesting here because what I'm seeing when I zoom in on this photo of him just laying here on this couch type thing is that it looks like he's got some concealer going on right at the corners. In the walking image that you see here, the corner looks exposed to me, and it doesn't look like there's any concealer there. Whereas in the image of him that he posted on Instagram, I'm seeing a more filled in corner, and when I really zoom in, it doesn't look like there's hair at that corner. It looks like it's some form of a concealer to improve the corner. So now what should Justin do? Aside from trying to avoid those tight hairstyles that we talked about, he has a few options. One is he could do nothing. He can just accept the fact that he's starting to lose some hair and really not do a whole lot about it. That's a reasonable option. Another option is that he can shave his head, and some people choose to go down that route. I think that would be somewhat extreme given that he has very, very early signs of hair loss. He can also choose to wear a hairpiece, which some people in Hollywood do, but again would be a bit extreme for his type of hair loss and not something that I think he would do for many, many years if he even wanted to go down that route. Lastly, he can go down the route of hair restoration. And with hair restoration, it kind of breaks down into two main types of approaches, right? You have a medical therapy approach and you have a surgical type of approach. And there are a few things in between. There are two primary hair restoration goals. One is to stabilize the hair loss and to enrich the existing hair follicles. And 2 is to consider augmentation options with, say, concealer, scalp micropigmentation, or even a possible hair transplant. These are not mutually exclusive goals, and they can be combined to deliver the best possible outcome. Please make sure to subscribe to the channel if you aren't already. Many people watch our videos but are not subscribed, so subscribe, turn on notifications. Thank you. So let's talk about stabilizing the hair and promoting regrowth of the hair. There is the tried and true method, which is the first line of hair restoration for medical therapy, and that includes Propecia, or the generic form, which is finasteride, and minoxidil, which is sometimes known as Rogaine. Rogaine is the topical, but minoxidil comes as a topical or an oral formulation, as you guys know from our minoxidil video. The second line treatments would be something like microneedling. It would be PRP, which is platelet-rich plasma, laser caps, and biotin-based vitamins. That would be second line, but the first line is what I always tell people. It's going to be the Propecia and the minoxidil. Some people choose not to take some of these medications because of side effect profiles, and I respect that. And then we'll go into the second line of treatments when that's the situation. As far as augmentation goes, there's a concealer option. These are keratin fibers that have different colors to them. They're actual keratin proteins that are colored, and they can blend undetectably with existing hair. And you can kind of instantly create the appearance of a more natural type of thicker, fuller hair. Another augmentation option for the hair is scalp micropigmentation, or sometimes known as SMP. This uses ink to temporarily mark the skin, so it's almost like a temporary type of tattoo. It doesn't go as deep as a tattoo does, and it gives the illusion of some hair. It is two-dimensional, so it doesn't look as realistic as actual hair. It also will reduce, hopefully, the scalp shine through that some people have. It also slowly fades over time. It may not completely go away. That's something to keep in mind, and the color might change over time. There are multiple sessions that are usually done for scalp micropigmentation, and then we have, of course, the hair transplant augmentation option. There are different types of hair transplants, as we talk about on this channel. It's important to budget the hair that you have. There is a finite donor supply of hair that we all have on the back of the scalp, side of the scalp, and then of course there are some other donor sites like the neck, like the chest and the back, but they're never going to be as great as scalp hair, as we talk about in other videos of ours. And so it's all about trying to figure out how much hair is needed at the recipient area and how much hair you have at the donor area. It's that equation that we're constantly juggling. And there are two basic types of extraction methods, FUE and FUT, and we've done videos talking about each type and the pros and cons. For Justin Bieber, what would I do if he came to the office and said, I'm looking for a hair transplant at this stage? I would make sure, first of all, that he's on medical therapy to reduce the progression of his hair loss. That's very important. And I would offer him a procedure that would be on the conservative end, because he doesn't have a ton of recession, and he overall has pretty good hair fullness in the mid-scalp and crown. So I would go with a procedure of about 1,200 to 1,400 FUE grafts to the frontotemporal areas and to the temples to bring them forward and reduce that scalloping appearance of the temples, and to just better reframe his face. And we would do a donor shave approach where, since he's already used to short hairstyles, I would just shave the back to allow us to then get the grafts. I do prefer shaving the back of the head compared to doing a no shave technique, because I feel like my distribution of the FUE harvest is a bit more balanced and properly distributed, and I think that's important. So that's the way that I would approach Justin Bieber's hair if he wanted to go down the hair transplant route. But of course, he doesn't need a transplant. No one needs a transplant. It might just be something that he one day decides on, like many other celebrities have. And no matter what he decides, we're gonna love him, we're gonna support him. And I think it would be cool that if he one day did get a hair transplant and decided to actually come forward with the information and tell the world about it, I think it would do an amazing thing to destigmatize this surgery, the hair transplant surgery, which is very common and most common type of cosmetic procedure for men around the world. And I just think that would be a really cool thing if he ends up one day getting that type of surgery. Make sure to check out our hoodies. These are I Feel Beautiful hoodies, and it's our first attempt at body positive merchandise, so please check those out. Make sure to pick one up. If you enjoyed the video, like, subscribe, and also comment below. Let us know what you think. And if you really enjoyed our video, make sure to check out our Elon Musk hair transplant analysis in this card right next to me here, and we will see you there.